Perfect. So again, thank you, everybody. Our first speaker today will be Roberta Pressman. Roberta Pressman is a clinical psychologist who worked in community mental health in Boston for 25 years, where she developed and supervised the Family Therapy Training Program and provided clinical treatment to individuals seeking help there. Roberta was director of internship training at Massachusetts General Hospital in Boston, where she supervised medical residents and psychology interns, and was on the faculty of the Massachusetts School of Professional Psychology. She maintained a private clinical practice for 30 years in Boston before moving to California, where she helped to develop and oversee member support services at Ashby Village. Please welcome Roberta Pressman. You're muted.
Yeah, good morning. So nice to see you all, and I hope I will be able to see most of you in person before too long. Anyway, as Eric said, member support often gets questions about who we are and what we do. And so I'm hoping that today's presentation will help you get to know us a little better. And as Eric said, if you have questions, please put them in the chat box or feel free to contact any of us in days from now or weeks from now if you have other questions. So I'm going to start today with an overview of member support and services and a history of member support, and then tell you a little bit about the Healthier Aging program, which is the program that I'm involved with. So 10 years ago, Ashby Village started out with just 3 teams. Believe it or not, it's just the events team, the volunteer team, and the social services team. And at the time, we weren't quite sure what social services at a village should look like. And we started out with the assumption that we'd be helping members with serious health issues and personal crises. However, after getting to know our members better and learning more about the aging process, we began to look at our mandate in a very different way, and we recognized we could do more than just focus on illness or, as we sometimes say, decrepitude. We could also focus on wellness. And in doing so, actually, perhaps slow down or improve some, even if not all, typical normative issues related to aging. So we asked ourselves, what might we do to keep Ashby Village members well? Could we counter the effects of muscle and bone loss, loss of balance, memory, and even to a lesser extent, perhaps some kinds of arthritis and chronic health conditions? We believed and continue to believe that we can keep our members healthy and independent as long as possible by encouraging physical activity, preventing social isolation, and educating members about good health and nutritional practices. And so, Eric, first slide. So we morphed from one team, the social services team, now called social care, to a range of services with an emphasis on prevention. So I'm always get a little oh, wow, when I think of our one little box when we started out and see where we've come. So you can see the range of services. And if you look from left to right, from healthier aging all the way over to the other end, you'll see that we have a continuum of services starting out with prevention and going, leading across to both intervention at Ashby Village and referrals to outside resources. And you'll hear about each of these teams from their team leaders. But now I'm going to tell you about the team that I work with, which is the Healthier Aging team. So as more and more research linked physical activity to healthier aging, we started the Healthier Aging Initiative about 5 years ago with a campaign called On the Move. And that year we did a lot of work encouraging physical activity among our members. We started a whole group of exercise classes, which many of you may have already attended. So we have a great yoga class, Tai Chi, aerobics, strength training, and even an exercising your memory class. And by the way, there was a fabulous article in yesterday's Times on the link between exercise and brain health. It strangely showed up in the sports section, but it's a really good article. Organizations offering fitness programs such as the Y and the senior centers. And we began an absolutely marvelous, robust hiking program into the redwoods and Tilden forests, and led by our wonderful hiking leaders, Audrey Newman, who's with us today, Claire Heiselman, and Celeste Burrows. And Eric, would you show the next slide, please? So we had wonderful, wonderful hikes and lots of fun. And sadly, we have had to curtail that program because of health and safety issues. Show the next slide, please, Eric. So for a while, we thought maybe we could keep walking with social distancing, but it just didn't work. So sorry to say, we're going to have to wait till the virus goes away. But I really want to encourage all of you, if you're not already doing it, to really get out every day and try to walk, try to get some fresh air. Because speaking from personal experiences, I have to say I feel so much better when I've been outdoors and taken some kind of a walk. I also want to let you know that not all of our classes have been canceled. We still have 2 classes online, Ada Lusarde's wonderful yoga class and Ann Aronoff's strength, stretch and dance class. So those are available, and we also have a link to the Y classes, which are excellent too, and I encourage you to try some of those classes as well. So that's the active part of Healthier Aging, a program that, as I said, encourages physical activities. The second part of our program involves education on health and nutrition. So through our newsletter column and our quarterly lecture series, Embracing Change, which is what you're part of today, this is one of our Embracing Change lectures, we offer information on the latest research on health and nutrition and topical issues such as the use of cannabis for pain, hospice care, plant-based diets, and important documents to have as you age, and many other issues like that. So this is Healthier Aging in a nutshell. I could go on and on, but there's not enough time to do that. So I just want to say that I hope you are participating in some of our programs, and if you're not, I hope you'll try them out. And if you're interested in joining our team, we would love to have you. We need help in writing the newsletter columns and planning the Embracing Change presentations. And if any of you have skills in this area, we'd love to have you come and talk. And direct that program as well. So thank you so much for hearing me out, and I'm going to turn you back to Eric.
Great. Thank you so much, Roberta. Next, I want to introduce Ellen Newman and the Connections team. So Ellen Newman has a PhD in clinical psychology and is licensed as a marriage family therapist. She has taught in the psychology departments at both JFK University and St. Mary's College. At Suicide Prevention of Alameda County, which is now called Crisis Support Services, Ellen helped develop a grief counseling program for homebound seniors. Additionally, she was a staff consultant to the Crisis Support Services clinical supervisors. Ellen was in private practice for 25 years, working with people who were struggling with issues of aging, grief, and death and dying. She has been a volunteer at Ashby Village for over 2 years. Please welcome Ellen Newman.
Thank you, Eric. Hello, everybody, and welcome. I would like to do 2 things today. I'd like to tell you, of course, about the Connections team, and I'd like primarily to tell you who the Connection team, who's served by the Connection team volunteers, and then I'd like to tell you a little bit about the support and training of our volunteers. Most of the people who are served by the Connection team, most of the Ashby Village members, are some of our most isolated members. Some of these people are no longer able to drive or aren't able to drive for a period of time. Many of them do not have any family that's local. Some of these people have very few social relationships. They may be experiencing a difficult transition time, and they often do not participate in other village activities, not because they don't want to, but because they can't. So the connection team volunteers often, well, before the pandemic, of course, we visited in person. And some of the things that the volunteers would do is they would help the members access other services. Often they would take members on walks. They would read to Ashby Village members. We had somebody who was visually impaired, and she had someone come in on a weekly basis to go through emails and bills so that she could take care of those things. A lot of the visits is purely social. People go out to lunch, go out and have coffee. We had a member who only wanted somebody to come and watch ball games with him because he hated watching the ball games alone. So our volunteers do a variety of things. Many of our volunteers are people who have a background in sociology, psychology. This is not a requirement. It just happens to be where they come from. Right now, we have 20 extraordinary volunteers who contribute their time, friendship, and compassion to people who are primarily homebound. The way an Ashby Village member gets in touch with somebody on the connection team is the member is either referred by either another member or a volunteer, but the way it works is the member will call the office. Generally, I will get that call. Sometimes Eric takes that call, and soon Mimi Wolf, who will be introduced in just a minute, might be taking those calls. The member calls the office. I return that call and do a brief phone interview. So I find out what the member's interests are, what the member's needs are, what he or she is looking for. And then I try and match that member with a volunteer who has some similar interest. We used to be concerned about how much distance there was. We tried not to match people who lived in Albany with people who lived in Oakland, but that's not much of a problem now because almost all of our visitors are working on the phone or using Zoom. These relationships become established. We have people on our team who have been seeing the same Ashby Village member for 2 years, 3 years. People become real friends. This is what happens. And we fill a role for some people that's very important socially because they have been so isolated. One of the real advantages, one of the advantages of the frequent contact is that the connections team volunteer is very often the first person to notice that there are changes in the member's situation or maybe in the member's health. Don't forget, these are people who see each other on a weekly basis. So it becomes possible for the connections team volunteer to help the member get in touch with other services that might be needed or that would be useful. Our volunteers meet monthly. We have meetings that involve in-service training, support. They meet to share ideas. And this is a place where they get some support and new ideas for how to work with the people who they're seeing. On an ongoing basis, Eric and I are always available for consultation. Our office staff is invaluable as well in that respect. Because of the pandemic, you can imagine, even though our visits are no longer in person, how vital it is that somebody knows they have a person who calls them on a weekly basis. Thanks very much, and I'll turn the meeting back over to Eric.
Ellen, we just had 2 questions for the connections team,
Sure.
if you don't mind. How many members are served on an annual basis by the connections team?
Oh, it's a good question. We have 20 volunteers. Generally, each volunteer sees 1 person. Some of the volunteers will see 2 people, and I'd have to do that math. I mean, sometimes we might only see 20 people in a year. Sometimes it depends on how long a member stays with us. I'd actually have to look at my records. Whoever wanted to know the answer to that question, if they contact me, I can get that information to them. I'm sorry, I just don't have it at my fingertips.
Yeah, Mary, we can talk offline and we can get that information to you. No problem. Thank you, Ellen. Thank you.
Okay. Did you have another question, or is that it?
Oh, that was it. That was all I had. Thank you.
Okay, thank you.
Great. And so now we'll move on and talk to Dagmar Friedman, who will talk about support groups. Dagmar holds 2 master's degrees, one from the Berkeley School of Social Welfare and one from the School of Public Health at Columbia. She has developed and run vision rehabilitation programs, taught medical students, led support groups, and had a private practice for individuals and families. She moved from the East Coast to Berkeley in 2011 and has been a member of Ashby Village ever since. Please welcome Dagmar Friedman. Are you muted, Dagmar? Yep.
How's that?
There we go. Thank you, Dagmar.
Okay, so welcome everybody, and raise your hand if you can't hear me. All of us thrive better when we feel a sense of community, when we feel we are cared about, and when we feel competent. And all of these things tend to be threatened as we get older. Our support groups tend to help us with all of these 3 basic needs. They enable us to tell our stories about the things that have troubled us, that we may feel no one understands. So let's say the over 80 discussion group will maybe group together people who are struggling with illness, maybe struggling with the loss of dear ones in their families. They may have few connections, and being able to tell their stories to people who understand makes an enormous difference. We have a vision loss group, and vision loss is a very common problem as we age, particularly the diseases of macular degeneration, glaucoma, cataracts, diabetic retinopathy. This group is something very dear to my heart because I used to run vision rehabilitation programs, and I realized how little the medical profession prepares people who are losing vision to manage. And most people can manage quite well, even with very limited vision. So you can imagine how it feels to be able to talk to other people who can't see very well, who bump into things, who can't recognize the face of their grandchildren or those they love. And in this group, not only do they share their stories and their frustrations, but they share tips. And you'd be surprised how much we learn from each other by listening to each other's stories. And the same would be true of the hearing impaired group, which is also another very serious problem as we age. Many of us can't hear the way we once did. And this group shares their frustrations and also gives tips and ideas for how to function. We have a fall prevention group. All of these groups are open to all of you, and all you need to do is call Eric or the office, and we can direct you to the group. You can perhaps talk to one of us before, just to find out a little bit more about the group. The vision loss group is meeting by Zoom, and it's amazing how important that Zoom meeting has become to this group. We see each other and we feel connected, we feel cared about, and we feel more competent. And the same is true with the hearing loss group. And that's harder because it's hard to, if you have very little hearing, it's harder to hear each other. But anyway, we welcome all of you and hope that you will be interested and join us. So thank you very much, and I look forward to talking to any of you who are interested.
Marvelous. Thank you, Dagmar. Thank you.
Eric,
Yes, Ellen.
excuse me for 1 second.
Of course.
Could you ask Mimi Wolf to give a wave because we didn't introduce her?
Oh, goodness gracious. I'm sorry. Where is Mimi Wolf? There she is. I see her. Could you give us a quick wave? Thank you. We had forgotten to introduce her. She is going to be co-leading with Ellen for the Connections team in the very near future.
Thank you, Eric.
Yeah, thank you. Thank you very much. Sorry, Mimi. No disrespect, I promise. All right. So next up, we have our Julianne Morris and the social care team. So Julianne is a longtime social worker who got her master's degree in social work at the University of California, Berkeley. She spent over 20 years in New York City working in hospital emergency rooms, engaged in crisis work, and developing programs related to rape and domestic violence. She wrote the grant for and started the first battered women's and children's shelter in New York City. She then worked for over 15 years as the director of social work in several hospitals in New York City. Upon her move to California in the early 1990s, she trained to become a divorce and family mediator and child custody evaluator and worked with an attorney for several years. She has been involved with the social care team since its inception. Please welcome Julianne Morris.
Hi, everyone. Hopefully I'm unmuted. Welcome. As you know, one of the goals of the Village movement is to help seniors stay in their homes. And so as a part of that effort, the social care is a team of retired or semi-retired mental health and other healthcare professionals. And we meet once a month. We're available to consult with members who are facing really serious changes to their health, their ability to live independently, or changes affecting their well-being brought on by loss or illness of a partner, or changes to their social support system. The first call for assistance when someone calls Ashby Village for our services goes to Eric. And then if Eric feels it's appropriate, he refers the person to me as a facilitator of the team, and I refer it to one of our 11 social care teams. We can make up to 3 home visits or, of course, telephone visits. And what we're really there to do is to help our members evaluate their situation, look at problems, look at solutions, and to come up with and connect members with necessary resources. For example, finding a home health aide, resources for getting food in your home, and many, many other kinds of organizations. So we really try to connect our members with necessary resources, either within the village or outside. We have worked on and continue to work on finding the best possible services to meet our members' needs. And we are always looking for volunteers. So if anyone feels like they would like to join us, we very much hope to hear. Thanks.
Great. Thank you, Julianne. I appreciate that. Now, before we move on, I just want to make sure that everybody knows how to contact us. So here's how we contact member support. It's been mentioned a few times. Again, you can always reach out to me, and I'd be more than happy to distribute that question or concern to the appropriate place. But you can see here that member support, the easiest way is to email me. We have Healthier Aging with Roberta Pressman and her email there, and then the connections and how to get a hold of Ellen. All right. So now that you've heard about all the wonderful services that Ashby Village can provide, what happens when Ashby Village's services are not enough? Today, we have Senior Alternatives to talk about what those next steps look like. Today, we have Janet Brush and Anne Lamont. Janet Brush is the founder and CEO of Senior Alternatives. She has a master's in social work and a Master's of Science in Gerontology from USC, and is a licensed clinical social worker in the state of California. She also has a Bachelor's of Science in Business Administration and extensive experience in the field of gerontology, including working with a variety of issues such as dementia, depression, caregiving, and other problems associated with the aging process. In addition to her work in the private sector, Janet has worked in a variety of hospital settings, including New York University's Aging and Dementia Research Center and Cedars-Sinai Hospital in Los Angeles. And we also have Anne Lamont, who has a Master's of Social Work and a Master's of Public Health from Columbia University. Her most recent experience is with Evolent Health, where she worked as a complex care social worker for geriatric clients with serious medical conditions. And previously, she worked as a Medicare social worker and as an adult aging health program manager in Oakland, San Francisco, and New York. She is also a master trainer for the Chronic Disease Self-Management Program and proficient in both Spanish and French. Please welcome Senior Alternatives.
Thank you for having us.
Thank you. All right, everyone, I'm going to share my screen so that we can see our presentation, our slides. Give me just a moment. There we go. And I wanted to start by thanking you all, of course, for being here today. Of course, thank you to Ashby Village for inviting us to speak. It seems important to take a moment to acknowledge that we're all living in a difficult and an especially challenging time right now with everything that's going on, and it affects all of us every day. So if you have found yourself feeling some difficult emotions or perhaps physical signs of stress, we want you to know that you're not alone. And of course, you have the wonderful support of Ashby Village. There's also Adult Protective Services, which essentially, as you may know, is the 911 for seniors and other vulnerable adults for the county. And you know, if you're ever feeling stuck, if you're not sure, you know, of your next move, of course, please don't hesitate to reach out to us at Senior Alternatives. We're available for a free initial consultation. We'd be happy to offer what resources we have, a quick talk on the phone, a long talk on the phone. We are available, and just so you know, our staff and one of our care managers, social workers, is available 24/7 for clients who need it.
So anyways, this is not planned, but I just want to let you know that in all my experience in gerontology, I don't think I've been as impressed and felt as odd by an organization such as yours. Mm-hmm. I knew about the villages, but I never really did a lot of detailed research on them or really understood the in-depth and important things that you're all doing. I wish we could take the United States and all the seniors and hook them into something like this, because I think the world would be a lot better of a place. Let's face it, right now we need to hook everybody into something, but right now we can only take care of our seniors because that is our job. So I just want to let you know, I'm almost touched by what I just heard and the amount of wonderful experience that goes into what you're doing. It's amazing. So anyways, what we're going to talk about today is, there's nothing that's complex, nothing that's going to be difficult, but it's something that is really important. And that's empowerment. The important thing is at the end of this meeting that you're able to feel comfortable with where you're at right now in your life, your current life situation, but even more so where you're going to be going in the future. What might happen in terms of if there's some sort of an emergency, how are you going to function in an emergency? Where do you want to see yourself in the next 15 years? How are you going to get there? How's that all going to happen? And it's not something that we go to school and we learn. There isn't a class about it. So that's kind of what we're going to talk a little bit about today. So it's, again, there's not a lot to it, but it's really empowering yourself. And how does that start? It starts by planning. The most important thing that you can do is sit down with someone, prepare in advance, sit down with someone. Anne, you want to switch to the next slide? To develop a roadmap. And that's how you have to think of it. And you have to think of it as there's going to be different, yield, stop. We're going to, be here at this time. I might be here at this time. So you really want to make it as detailed as you can. So, plan. The way I recommend doing this is by sitting down with people that you value in your life. It might be your children. It might be a friend. Some people have a professional fiduciary, and we'll talk more about fiduciaries later on. A lot of the time what I see is people will start with their lawyer. Sometimes they'll bring an adult child with them. Often the lawyer does not want the adult child to come with them. Some people will speak to us, and I'm sure there are so many opportunities to just talk with people at Ashby Village. And the things you're going to talk about are, who do I want to make my decisions for me when I can't make decisions? I think that's a lot about what this kind of empowerment and planning is about, is what happens if I can't make these decisions for myself? What happens if I go into the hospital and I have a surgery? That's a scary thing. If you don't have a spouse and you don't have adult children and you don't have a plan, we get a lot of, at senior hotels, we get a lot of calls of people that are simply just saying, I'm going to have surgery and I don't know who's going to take care of me afterwards. Or I have a friend, but what happens if I need help at night? Will I need help at night? So there's so many different things that can come up. And some people do have family and friends and a lot of support, but they still want to have a better plan. So this plan, again, I can't stress enough how detailed it should be. And one thing I have not seen, and which we should probably create, Anna, is a list of what you should be planning for. Like, what are the items on those lists? But some of the main items, and I know you do talk about this quite a bit at Ashby Village, are your legal documents. One of the first questions I ask when people call our office, as soon as I can, is, do you have a durable power of attorney for healthcare and finance? And do you have advanced healthcare directives? I'm honestly not as worried about advanced healthcare directives because, that's something, it's a little easier to get by in that area, but it's very hard to get by if you don't have someone that's going to make decisions for you financially and also personally and for your health if you can't. You will end up, and we'll talk about this later, in a conservatorship, which is not something that you want to be doing. The other important thing is, when you make this sort of plan, is write letters, write personal letters. This is something that a lot of lawyers don't tell you. To your children, to whoever your durable power of attorney for health is. I mean, the finance, and a copy should go to your durable power of attorney for finance. For instance, I really would prefer to stay at home with my partner. If my partner happens to pass away, maybe I'd like to consider certain community living situations. So in the event I'm going to do that, here are some of the ones I visited and that I like. And so you do this footwork, do as much footwork as you could do now while we're all, most of us can do it. Some of us can't. And if you can't, there's people that can help you to do it. So don't worry about that either. And there are placement, they call them placement specialists, but there are care managers, there are your own team members that can help you to make some of these decisions and get a plan in place. The other really important thing is, as things change in your life, reevaluate everything, your documents, your letters especially. And certainly if someone, if you have a spouse and he passes, then you definitely obviously want to make sure that you reevaluate your plan of action. Just sit down with your lawyer, and go over it again. Because sometimes you need to change the legal document, sometimes you don't. A lot of the times they try to write them so that they try to make sure that you're not going to have to make changes, so that they include everything, all kinds of changes, but oftentimes they don't. And people get stuck. I actually was a fiduciary for 20 years, a professional fiduciary. So I had so much experience in so many different cases. Okay. How do you know when it's time for help? Well, you have all the assistance that you need at Ashby Village, which is quite in depth and wonderful. And I don't believe this assistance that you have in Ashby Village, you could try and piece together in the community. You know, we have hundreds of services in the Bay Area, but some of the more psychological components and programs at Ashby that your village offers, I don't know that you're going to be able to get those outside. You could get those if you went directly to a care manager, but you might not, need to do that. You wouldn't need to do that if you're a part of Ashby Village. So what happens when the services are no longer satisfying your needs, and they're just, you're needing to get other services that aren't offered at Ashby Village? I think oftentimes your own social service director will tell you, look, I think maybe you should call this person. So they'll give you some referrals. But some of the ways to know to reach out, I think the number one way that we see is that people are just starting to feel overwhelmed. A lot of the times it's in one area, multiple areas. Often it starts to happen in multiple areas. You're feeling, anxiety about your bills, getting your meals ready, shopping, maintaining your home. I also think one of the things that we see is people start to feel helpless. That's another sign that maybe you're needing a little more help than you're currently getting. And as we all know, helplessness leads to feelings of anxiety and depression. And we do tend to bring in a lot of clients at this stage in their life. We do have people that call that actually just say, hey, I'm planning for my future. We do get that, but a lot of the times we get people around this stage. And they're becoming isolated as well. They're not wanting to be with their family as much or their friends. They might be feeling some embarrassment about something. Also, something bad happens. So a lot of the times you could, you could have dehydration or a confusion in medication or, the loss of someone, and it's a good time to bring in some extra support and help. We hope that doesn't happen. We work very hard, care managers work very hard, and so does Ashby Village. That's what Ashby Village is really about, is trying to prevent you falling into something bad happening, okay? And if something bad happens, then there's people around and there's systems in place so it's not a crisis. The other thing that you'll see sometimes are cognitive concerns. And remember, cognition is a very large spectrum. Just because your cognitive skills aren't as good as they used to be, it does not mean you have brain impairment. You don't necessarily have Alzheimer's disease, okay? Or any of the other types of organic brain syndromes that we see. It is normal as we age, starting at age really 30, to have word lossage, to have all kinds of different kinds of cognitive decline. It's a milder decline, but it's just there as we age. But it's important to look into it and to let your doctor know. And a lot of the times, as you can imagine, it's the feelings of being overwhelmed and helpless that play into, a decline in cognition. We see this all the time, especially at a time right now. I mean, there's very few people in really probably in the world right now that aren't having to really huff and puff and think and deal with a lot of different kinds of feelings. So that's something that we see a lot. And then, of course, probably the most common one is family concern. And it's your children or friends, family friend concern coming to you and saying, I'm noticing these certain things. And, mom and dad, we've been doing this for you, but I have my own responsibilities, and I'm feeling that you need more than what I can give you. So we see a lot of that as well. Okay.
And I'm going to talk about some of the more common services people tend to need. So home care is one of the most common services. Home care is assistance with non-medical care and household management. A caregiver can provide many things for a client. Almost all of these you probably are familiar with. A caregiver can provide meaningful companionship and take the lead on starting activities and participating in activities that the client would enjoy. The caregiver can offer assistance with personal care, meaning help with showering, toileting, etc. The caregiver can offer housekeeping, grocery shopping, cooking, so that your nutrition is improved, and of course transportation to doctor's appointments so that you don't have to worry about how you will get there or return from the appointment. Perhaps if you're interested in doing some grocery shopping with the caregiver, that's another option as well. Another common service is care management, and this care management involves helping clients to attain their maximum functional potential by offering really a holistic approach. So we start with a comprehensive biopsychosocial assessment in order to identify the client's strengths and challenges. And there's many questions regarding their physical, their emotional, their cognitive function, and as well as their medical care and much more. We are then able to tailor the care plan accordingly and propose some really specific interventions. And we work with the client and their family to educate, to provide advocacy in many areas, both between the client and their family members, as well as with outside professionals. What we see a lot of the time is that there are families where they're well-meaning, but they're, the care manager kind of needs to have some meetings with everyone to really provide what we call the psychoeducation around, issues of aging, specific issues for the client, so that everyone can be on the same page and really up to speed on what's actually happening so that they can better support the client. The care manager also works closely with the caregivers, if there are caregivers in place, to really ensure that the client's care plan and the care instructions are followed very, very closely, and that if any updates are needed, that those care instructions are updated accordingly. Care managers are also able to work with the client on perhaps transitioning to a new housing situation, coordinating any legal documents that they need to get in order, and also ensuring that a client's medical providers are communicating with one another. A lot of the time, a client may have a primary care doctor and several specialists who may not all be in constant communication. So really making sure that that's happening is a key role. And finally, a really important piece of care management is to get the client involved in meaningful, joyful activities. Again, really activities that, what we like to say, make their heart sing. These are activities that they may have loved in the past, or that they still love to a certain degree and perhaps haven't been doing recently and haven't been getting that joy. So for instance, a client perhaps used to love to go to the opera and for many reasons isn't able to enjoy that anymore. Well, the caregiver, or the care manager, can arrange to have the caregiver play opera music in the home and provide that listening session so that they can remember that joy that they've felt by going to the opera. If a client was an avid family photographer, the caregiver can help to organize with the care manager's influence a photo album for the client to flip through and fondly recall all of the family that they've had throughout the years and different changes and kids growing up, that sort of thing. Perhaps the client always had a green thumb, but physically maybe isn't able to really get in the garden as much anymore and do all of the digging and planting. Certainly the caregiver can assist with getting the client outside in their garden to do a little bit of that so that they can really still enjoy that aspect of things. Oops, sorry about that. Go ahead, Janet.
Before I go on to this, we can talk about this a little bit later, but we should probably talk a little bit about what care management and home care cost in general. So why don't we do that? And I think someone's going to ask that.
Okay.
We'll put that on our list, Anna. Something else you want to bring up. So Fiduciary is used in a lot of different ways, especially I noticed in the Bay Area and in different states too. But it means trust. So a fiduciary is anybody that you are entrusting to act on your behalf to make decisions for you that you previously designated. There are a lot of different kinds of fiduciary relationships. So there's, of course, our power of attorneys, for healthcare and finance. Certainly somebody who would be carrying out your advanced healthcare directives. Typically it's the Durham power attorney for health. Would be a fiduciary. A lot of us are trustees of our own trusts, but you have an alternative trustee, that's going to be a fiduciary. I'm leaving conservatorship for last. Bookkeeping is a fiduciary. We have a lot of clients who are doing quite well, but they're just a little overwhelmed and they might need someone to help organize their bills and get their checks out. So that's a fiduciary relationship. There are a lot of fiduciary relationships. So when people say that word, don't just think of someone that's a professional, but there are a tremendous amount of professional fiduciaries out there. We can give you referrals. I know the village has their own referrals. They're professionals. They get paid a certain hourly amount, and they can be very helpful as well, and can become confidants and friends as well. Conservatorship, the reason why I left that for the end is typically court ordered. It's because somebody did not get their paperwork in order, their legal documents in order, and they don't have they either don't have a Durham power of attorney for finance or for healthcare. Believe it or not, the healthcare one you can kind of fudge through a little. If you're an adult child and the doctors feel comfortable, they'll listen to you. But the finance, you cannot fudge through that. So if you don't have somebody to act on behalf of you with your finances, if you cannot do it, someone has to petition the court. It doesn't matter how many children you have. The banks, your stock brokerage accounts, no one is going to speak to your adult children. So that's really important. And that's how you end up in a conservatorship. There are a lot of other reasons too. Sometimes children cannot get along to make decisions for their parents, or there are a lot of people that just don't have anybody and they never got their power of attorney documents prepared. So the court steps in, hopefully someone catches them. A lot of the times it's Adult Protective Services, and they have a conservatorship. They're very expensive. The money comes right out of the client's estate. Everybody gets paid. Courts get paid. There's at least 2 sets of lawyers. Sometimes there's more. The conservator gets paid, of course. And it's sometimes can be a big mess. So you want to try and not have a conservatorship. I actually saw a document recently, which was interesting, where it was a power of attorney, they called it power of attorney document, but it was really, I couldn't tell if it was finance or healthcare. Actually, it was a very interesting legal document someone asked me to look at, because what I could tell them is whether we would accept it or not, but it appointed a conservatorship if they needed one, and that's not a bad idea. Let's hope that never happens. I think this was a situation where maybe they were worried the children wouldn't get along, so they appointed their own conservator. Okay, good.
So another common service folks tend to need is an alternative living option, and they may need assistance with selecting and then also transitioning to this next living situation. You're probably somewhat familiar with all of these, but I'll go through them nonetheless. Independent living is where you live in congregate housing in your own apartment, but there is a central dining room and usually housekeeping for your apartment. There may also be some social activities arranged. Assisted living, you have everything with independent living, and there's usually a stronger social component to that. And there are also caregivers available through the facility to offer a la carte services such as medication management and assistance with various personal care needs. Residential care facilities for the elderly, or RCFEs, are also commonly known as board and cares. They're similar to assisted living facilities, but they tend to be much, much smaller. They're usually run out of someone's home, and they don't tend to offer as many of the social activities. Continuing care retirement communities, CCRCs, are places such as Piedmont Gardens or St. Paul's Towers. They're places where there's usually a fairly large buy-in fee, but then you're set for life. So you may start out in the independent living and then transition through assisted living, perhaps a stay in their skilled nursing if you are recovering from an injury or an infection, and eventually you may go to memory care. So there are increasing levels of care that you're guaranteed to be able to stay in for the rest of your life. There's also a monthly fee attached to that as well. There's also a nursing home or skilled nursing. Most people don't tend to live here permanently. It's usually a relatively short stay, usually covered by Medicare, following a hospital stay, and you're getting some sort of rehabilitation, or you just have a skilled nursing need where you're needing to stay there and not be in your home. Finally, there is memory care, usually attached, but not always, to an assisted living facility, where folks who need that extra layer of support have it. There's a lower caregiver to client ratio, meaning that there are more caregivers for each client available, as well as they're usually locked units, so that if the client attempts to open the door, there is an alarm that goes off so that we can prevent any kind of wandering outside of the facility. So one of the most common services at home that people tend to need is home health. And home health usually follows a hospital stay, but not always. Home health can be ordered by your primary care doctor if you have an acute change in your health, and for instance, you need a physical therapist to come to your home, or an occupational therapist to come to your home and do teach you some exercises. Usually with home health, there is a set number of visits established, and you're able to recertify those visits if it's determined that you need more care. The standard model is that a nurse case manager will be in charge of your home health experience, and he or she will come to your home usually once a week to check in with you and take vitals, etc. And then the physical therapist and occupational therapists will have other scheduled, perhaps twice a week, depending on what your needs are.
Oh, and sometimes with home health, if you are very, very ill, sometimes we even see people who have swallowing problems, so there's a speech therapist that comes out, but you're not on hospice because maybe you had an accident or surgery. So home health can also, although we listed these three things, these are the most common, become very detailed. So just so you know, without going on to hospice, sometimes they'll do a shower once a week. So just to bring that up, they'll leave an oximeter to check your oxygen, things like such as that.
Right, there's home health aides to help you with those activities of daily living, and then sometimes you may have a private caregiver as well to help on a more on a daily basis.
Yeah, it obviously comes before hospice. You haven't been, sometimes people who are on home health go into hospice, but a lot of the times they don't. They don't, because typically if it's going to be a hospice referral, it's done directly from the hospital. They know, doctors know, they say this person has less than 6 months to live, and they'll go on hospice. There's also something in the middle of home health and hospice, and they're like chronic medical illness programs. So depending on the home health company, Some of them have that too, where it's more stepped up than regular home health, but it's not hospice. And then of course they also have palliative care. So there's different kinds of home health as well. So what do we want to take away from here? I mean, I think, you know, when we look at it, and it's probably because we've been in the field for so long, what we're talking about is it's very simple things that we all typically know about. But I think it goes back to the beginning of when we talked about people feeling overwhelmed. I think that's what we see, a lot of worry. And let's face it, you can't plan your life out. We all know that. We can try to, but it just doesn't usually go as according to plan. But you can try and be prepared. And that's what we're talking about here, because that's going to make you feel better. I can't tell you how many times we have people call and they just come in and speak to us for an hour. They're worried about things. And we talk about things and we give them some very concrete ideas. A lot of it is involved around planning. A lot of times they're going to an attorney, and sometimes they'll say, oh, can we use you if we need it? Put in a document, in the event something happens, I want a care manager involved in my care. And you can even name the person. You can name your home care agency. So you can make it very detailed, and just taking the time to really think about that, planning it, sharing it with family and friends. And then obviously today, more than anything at all, is you're very lucky to be living in this area and having access to Ashby Village if you want that, because you are definitely not alone with Ashby Village, okay? And you know, Anna and I were trying to think, like, what organizations, if you weren't part of Ashby Village, what other organizations, if you didn't know about care management, a lot of people don't even know about care managers and they don't want to pay. You know, how do you get connected in? And we could think of, you know, senior centers are closed. We could just think of adult protective services, but adult protective services, it's kind of a funny thing to bring up. They are social workers, and whether they have the degrees or not, that's what their role is. And especially the one in Alameda County, they're quite caring. And they'll be there for you as well. They'll be there on the phone. They'll speak with you. If you have a need, they'll help you as well. And they'll probably tell you to call a care manager, but they'll work with you a little bit, and they do not charge for that. So thank you.
Great. Thank you both very much.
Yeah.
Oh, sorry.
Oh, I'm sorry, Eric.
No, please. Real quick, someone had just asked a question about the cost of fiduciaries for handling a power of attorney.
We have a question right now, and that's why this just popped up. Do we want to answer questions, or just we have a vignette, but it's just so, honestly, it's pretty basic about what we've been talking about. But we couldn't. Do you want to do this, or do you want to just skip this and go on to questions? That's why I leave it at the end.
I'm okay with having the vignette go, and then we can ask questions. I've only seen a few questions so far, so I think I'd like to continue if that's okay.
So we'll go through this, and this is kind of a good example of someone that came into our organization and how she obtained services that she needed.
I'll go ahead and read it. I know you all can read it as well, but Mrs. Brown is a widowed 82-year-old. She lives alone and has a child locally and one in another state. Lately, she is starting to have a harder time doing her personal care and errands due to chronic back and shoulder pain and sciatica. Her diet has not been adequate because she's not comfortable standing much to cook good meals, and she's losing weight. Her home is not as clean as it once was, and there are multiple stairs up to her front door. Her daughter has noticed that her mother's current challenges, and they had a long conversation about planning for the future. Mrs. Brown called Ashby Village social care team, and they had several recommendations. While a volunteer was able to start bringing her groceries every week, they also gave her our contact information for senior alternatives to inquire about care management and home care.
Okay, so initially, usually Anna, or we have another wonderful, we have a group of social workers, Pam Smith would speak with the family and Mrs. Brown. Typically there's an intake, and we try and give everybody as much time as they need, and we do not charge for this, even if they want to come and visit with us. So in this case, they just wanted to talk on the phone. They did think they wanted to meet. So we met with them, and they wanted to actually do what's called the biopsychosocial assessment. They wanted to do our care management assessment. And often from that assessment will come a written care plan. Sometimes we don't need a written care plan. We try not to, everyone's very money conscious right now, and you don't have to have it, but there's always something in writing that gives the recommendation. So in her case, we called, before the meeting, we asked if we could call her brother. We asked the daughter if we can call her brother, and we were able to do that because we wanted to get his impressions going into the assessment. So we have our assessment form, which has everything that you can possibly need to ask. And so we went through that and asked him the pertinent, and got the pertinent information that we would need from him. And that is important for us, is to get to see who are accurate reporters and what are people's thoughts. So we had that meeting. Typically what happens is we're always ending up starting with some caregiving. There are times when that is not the first intervention, but a lot of the times it is, and it could take care of a tremendous amount. So in her case, one of the care plan recommendations was to start with a small amount of caregiving. And the wonderful thing about caregivers, and we didn't talk about this, is you talk about empowerment. It's that person's liaison, it's their friend. Our caregivers become friend, family, and they're part of you. And then you're not calling your daughter or feeling bad that you can't do something. So she didn't really need a lot of hours, but we brought in a small amount of hours, and she started with, I think, probably 4 days a week, and then she went on to have more days a week, but 3-4 hours a day. And they were scheduled, I think now it's a little bit more, but where they come in the morning, they help her, they might go grocery shopping because she enjoyed shopping, and they help her with her laundry and cleaning, and they get some meals ready, and then there's always a meal left so that she has food in the evening. And that worked out really well for her. And then we also had the daughter talk with the doctor. A lot of the times doctors do not know what is going on with the patient. They're not telling them. And he did have an understanding that she had some pain, but daughter was able to go into that and bring her in, and the appointment became very much focused on her pain. Luckily for her, they just started her on some ibuprofen, and we encouraged, and he agreed, physical therapy in the house. So she started on home health, and which started with her nurse coming out, and then immediately the referral went to physical therapy, and she wasn't monitored by the nurse after that. And that really helped her a lot. The caregiver also was able to do the exercises with her. We also wanted them to meet with the lawyer, so the daughter felt comfortable with the mother, or the daughter felt comfortable with the mother, and the mother felt comfortable with the daughter, so they were able to go together and meet with the lawyer and talk about updating her legal documents and just tailor them to be a lot more specific. In terms of how we would follow up with a case like this, this particular case, we kept very close contact with the caregiver. Typically when a caregiver goes into a home, there's a lot of contact. Sometimes it can be every day. You're talking to the client, the daughter, making sure everybody feels comfortable with the fit, that the care plan is the right, there's an assessment done right away before someone even goes to a house. And it's, very formal assessment, home care assessment. So making sure they have the right assessment, it's working out, we don't need to change anything. And then in this case, there was just follow-up weekly by phone, and she didn't have much, she hasn't had much else come up. So we're really happy about that. The caregivers are very verbal, so if there's anything that goes on, they'll let us know, and certainly the daughter is verbal. So we didn't do any follow-up, regular care management follow-up after that. Might we have to? Yes, of course. In the future, something could happen, and we get back involved. We look at the care plan again, we retailor the care plan, we retailor the home care plan. So there's the care management care plan, and there's also the home care directions. So that's also an assessment and a plan of care. That is it. Thank you so much.
Thank you.
Yeah, wonderful. Thank you, Senior Alternatives. We did have 2 questions, though. I wanted to get back to the cost of fiduciaries for handling power of attorney.
And we realized we could also talk about costs of caregiving and care management if people want to know that as well.
Yeah, the other question that I was going to ask later was, what is the cost to use senior alternatives?
That's a good question. So fiduciaries charge different prices. Right now, probably like, depending on your fiduciary. For instance, when I was a fiduciary, I did a lot of this. They ask you to do the service that you specialize in. So I also did the care management. But my fiduciary charge, like if it was financial, you're maybe about $110 to $130 an hour right now. And that's why a lot of people do bring in a bookkeeper first, because they charge like $65 an hour, so it's cheaper. But the fiduciary is doing other things. They might have, they have rights on your bank accounts. They might be working with an investor on your behalf to make sure your money's invested correctly. It can go up. Some people charge more if they're doing a lot of care management, even though a lot of fiduciaries don't use care managers necessarily. They do it themselves, even though they might not have the background. They might charge up to like $130 an hour. And some are more expensive, but I'm giving you kind of the most common ranges that we see out there. And then care management. There's also large ranges, just like there's very large ranges in living environments. If you take a look at the handout that we gave you, it's almost, the ranges are so large. So for care management, you might find a care manager at $100 an hour. Again, it depends on their background. And sometimes if like we have an office and we have staff, it depends on their overhead. Up to like 200, we charge $155 an hour. So we're kind of in the middle. And all of our social workers are master level, geriatric clinicians, social workers. So very high level of clinical work. Because thank goodness all of you are doing okay, but we work with, as you can imagine, cases that are extremely complicated, very intricate cases where there's a lot of behavioral issues with dementia, clients that are running around that are hard to keep inside the house. We get into some of the most complicated situations. So we're very high level clinicians. And fortunately, a lot of our cases aren't like that. And none of you are in that current situation. We hope you don't get into it, but we can work with pretty high level situations.
And there's also, Janet, just to add on sort of where you might go next, is there are also a lot of situations in which there are very complicated family dynamics as well. We deal with a lot of that kind of situation too.
Tremendous amount. And then caregiving also ranges. There are some cheaper agencies out there, probably at about 28. You have to be careful about quality. Up to, God, some are charging what, like 35, 36 an hour. Anna, we're currently at $30.50.
We are.
And we, no matter where we're at, we are going to be giving anybody from Ashby Village a discount. I think, what is the current discount right now for Ashby Village? We have? Because
we have it. We do. So for a minimum 4-hour shift, the rate is $29 per hour. And if you were to need only a 3-hour shift, it would be $33 per hour.
Yeah, anything under 4 hours is now charged. If they're not in Ashby Village, is it, what is it?
$35 per hour.
Yeah. So our prices are definitely average. We give a free assessment if you are home care only. We also do a lot of care management for our home care only clients if they need it and they can't afford to pay for regular care management, and it's not ongoing. So we're very, we're a social work model. We're a little unique in the home care agency field, and we are licensed. I'm a licensed social worker, but our agency is a licensed agency in the state of California. But we are a social work model. We're not a regular franchise. I started the company. We're going on 25 years this November. Yeah.
Great. Does anybody else have any questions for Senior Alternatives? Or for the social care team, or for the connections team, or for healthier aging? I know that Patricia Sussman would like to say something quickly. Patricia, you have the floor. Oh, are you muted?
Mute. I've done it. I just want to say very briefly, as we're all here, that this program, which is incredibly exciting, and as was mentioned, is innovative, would not have happened without Roberta Pressman. And I think we can't forget that. She, from the very beginning, said, this is really important to do. It's complicated. We really need to do it. And she kept going, and here we are today. So Roberta, we all owe you a lot of gratitude. Thank you.
So kind, Pat. Thank you so much.
Thank you, Pat. That was very sweet. Thank you.
Eric,
I second that.
Yes. Do I hear MJ?
I put a couple questions on chat.
Let's see here.
You want me to say them?
Yeah, why don't you? I can't find them in my scroll.
I wondered how you are doing assessments, care planning, and revising the care plan in today's environment.
That's an extremely good question. When all of this kind of started coming down, even before the shutdown, I put out, before Gavin Newsom said anything, I put out an order for my care managers to not go see their clients unless they, spoke to me or to Anna about why, and then how we were going to do that. Because remember, it was early on, and they were still saying, don't worry about masks, but so we have had to, the first thing that we did is, thank goodness we have the caregivers in there. So we immediately identified those clients without caregivers. That was the first thing we did, and which are very few. And then we checked in on them to make sure they were okay, just so you know, because we had to do that first. But the clients that are care management and home care, because we kind of have to group them together in this kind of a crisis. We really had to take a look at how things were going to change. So, for instance, for care management, we immediately had to assess, did people have the right supplies for all of them, for every client, this right supplies in their house. So we have a infectious disease team committee, and we got together and we immediately talked about who we're going to be making these calls, how are we going to assure that masks were getting there, that of course sanitizer. So there were a lot of changes, but not only that, the protocols for everybody. Okay, so the care managers had their own protocols, but the caregivers were really the ones that we had to be, spot on with, because they're there all the time. So they have certain protocols, such as if your client is not a standby assist, when you're not with them, stay 6 feet from them. They always have to wear their mask. They always have to wear gloves, especially they were already wearing gloves, so that's not something that really changed during, if they're working with bodily fluids. But also just how they were going to clean the house, how they were going to clean their car, how were they going to bring, at first we did not want anyone bringing anybody in cars. We're just starting to talk about that now with the caregivers. What we do, and we started right away, is we have texts. We have most home care agencies have these online systems that are very technologically capable. So twice a week, the caregivers would get messages about hygiene. Okay, so wearing your mask, the whole thing, distancing, wearing, using hand sanitizer, wiping down the kitchen, all of that. But they get those regularly now too. In lieu of that, every time something changes, because there's all these changes that are happening, we then would send out another text, and we're still doing it. Things are starting to open up. What does that mean to you, caregiver? And then we even would develop these facts and answers questions and send those out. We'd text them, we'd email them. So it's still going on. I mean, it's not going to change. there's so much that we've had to do. We developed an infectious disease protocol updated, and it's in every binder, and every caregiver has read it. I don't like saying this, but it's a wonderful thing. We haven't had any problems. Even in facilities, we've been kicked out of some facilities because they're like, anyone that's not part of our organization, go. But we're still in many facilities, and we haven't had problems. We've had a few sniffles. They get to be isolated for 2 weeks. Okay, that's what the caregiver gets. They call their doctor right away. Everybody's involved with doctors. We're just using those doctors to kind of guide us as well. But there's a lot of communication. But it was really important with the care management clients, because remember, there's a reason why they're care management. They need more. We've talked to we pretty much told our care managers, whatever you need to do. Don't worry about charges right now. That was another thing. We just, we have to do what you have to do. So we're just taking care of them. Luckily, we also did it with our caregivers. I mean, you have all your employees too. So that helps too, by taking care of every caregiver, every client that stopped using us. So those are people that really didn't need the help, but they wanted it and it was extra. We call them regularly to see how they're doing, checking in on them. So it's just a lot of communication and adjustment, and it keeps changing, Mary Jo. And it's scary, and we've been doing great, but you know what? We are prepared. We have 10 COVID packages ready to go in our office. What happens if someone gets COVID? We're not going to say, oh, go to another agency.
That's great.
Yeah.
And I have wanted to remind you to tell people that home health ordered by a doctor is 100% paid for by Medicare.
Good.
You didn't say that.
Good. I didn't know that. I know insurance covers it, but I didn't know. I really didn't know if it was 100% or not.
100%, no copay.
And just to add as well, for anyone wondering about how we're doing assessments for new clients, given shelter in place, we had been doing them up until very recently, strictly on the phone or through FaceTime or Zoom. If there was a concern around getting a visual on the home environment, we've been working primarily with clients who have a lot of family involvement during the shelter in place. So we've been able to quite successfully start new clients just by the phone or Zoom assessment. More recently, we have started going in person to new clients' homes to do the assessments, wearing masks, staying 6 feet apart. And that's been working out fine so far. Windows
open, like everything possibly.
Yeah.
And if we don't have to, we don't.
Right.
Yeah. I mean, I think we've been lucky. I don't know what has happened, but things have, and I'm ready for things not to go so well. But things have gone okay. And, our clients' families don't really go near them either. There are times like right now where no one's allowed really not allowed to be exposed to anybody other than the caregiver. We can't have our caregiver exposed to family. So recently we've been doing some creative things like everybody else, like, there's outdoor visits, window visits. So, you open the window and we're trying our best to just be as creative as we can. So, Mary Jo, it's constantly changing, and we're just trying to stay on top of it. Like anytime anything happens, Anna's the one, she gets that text to the home care director and it's out. Because let's take it, we'll send a text out, hey, wonderful caregivers, we love you all. Everything's you guys are doing an amazing job. We're spiking this week. Please don't leave your home other than go to, there's a lot of stuff that goes on.
A lot of education and communication.
And where we put those caregivers, you go to a facility, we don't want you in someone's home. Although the people going to the facilities go right into the rooms and right out. So I don't know that it's that, but we're just being super careful. We're trying not to put people on a case the same day to somebody else. If they do, they have to bring the change of clothes and they have to wash up in the bathroom. There's just so many things that have to be considered. But it's amazing, the fact that we haven't had any problems. And a lot of our caregivers are high riskers, just like our clients are. it's not just, we have a lot of caregivers that are elderly, that are, well, seniors. I don't like to say, you know, I wouldn't even, because they're doing great. They're doing very well. They're out there caring for other seniors, but they're doing well too. You know, they have to stay home. They have to protect themselves, and they know they love seniors, and they know if they do anything wrong, they could kill somebody. So short of saying that to them and trying to be supportive, we're very much into communication with them.
And a question came up, do you have to present the protocol plan to the state in the same way that other businesses do?
No, in matter of fact, we've been a little disappointed because about 4 years ago, they started licensure for non-medical home care agencies. They never had it before. And of course, they charge you a very large fee. It's not like social work fee. I just paid my dues. And they don't really offer a lot of support or guidelines. We're pretty disappointed in that. We went looking for it and we couldn't find it. So between the CDC, Anna, you know, Anna's our public health person, all of us, we have this wonderful. Does anybody know Robin Sanow? She was a social worker for Adult Protective Services for 30 years. Well, she has been working for us for about 9 years, and she has a nursing degree as well. So she's really, you know, we have a team, we put it together, and we just have to make it happen. I don't know what it's called the Bureau of Home Care, and it's a state organization, just like the Bar and the Board of Behavioral Sciences, and they're doing nothing. No.
Okay, great. Thank you for answering that. Any other questions for Senior Alternatives or for the member support team? Well, I thank everybody for being here today. We had a huge crew. I really appreciate. We want to thank again the member support team, Roberta, Ellen, Julianne, Dagmar. We also want to thank Janet and Anna so much for being here today. Thank you guys very much for being here. Thank you, Ashby Village and North Oakland Village, for being here today. Thank you all. And again, if you have any questions, please don't hesitate to email me directly and I can make sure the right person gets the information. So again, thank you everybody and hope everybody has a great rest of their day. Thank you.
Thank you.
Thank you.
Bye.
Bye.